Good afternoon. Thank you so much for joining us today. I am Tasha Blackmon, President and CEO of Cherry Health. I'd like to welcome our panelists and all of you, our Facebook Live viewers, to this important discussion around how we can leverage this time of addressing social inequities and injustices to create real change in our community. In the words of Maya Angelou, if you don't know where you're going, you don't know where you've come from. So it's very, very important for us to understand where we're headed. And in order to know where you're headed, you have to know where you've come from. So I would be remiss if I did not say happy Juneteenth to those of you that celebrate. Today marks the 155th anniversary of Juneteenth. And for those of you that may be unfamiliar with what Juneteenth is, I'll just provide a quick history lesson. Now, while the Emancipation Proclamation was signed on January 1st, 1863, and that really ended slavery, it was not enforced in Texas until a couple years later. And this was primarily because Texas did not want to acknowledge the end of the Civil War, and they really didn't want to end slavery. So they were required to eventually end slavery by an order by Major General Granger on June 19th, 1865. So, really, Juneteenth is Independence Day for Black people. So, while we also celebrate the 4th of July, many of us celebrate the 4th of July, we also proudly celebrate Juneteenth as our Independence Day or our true liberation from slavery. So that is your quick history lesson on Juneteenth. Now, the reason why this work is so important to Cherry Health and community health centers like Cherry Health is because we were actually born out of the civil rights movement of the 1960s. Our goal was to ensure that all patients, regardless of race, regardless of your ability to pay, had access to quality, affordable health care. And the goal at that time was to remove every single barrier to care. You know, it's really interesting that 60 years later, we're still fighting that fight. And we're also, again, dealing with this issue of social injustices, which is also a public health issue, just as the healthcare disparities are that I talked about a few minutes ago. So, as an organization, we participated in a day of listening and understanding. And this day was hallmarked by three specific segments. The first segment was education. We talked about the Black people's suffrage movement in this country over the last 400 years. The second phase of our day was reflection. So you're going to see a picture in a few moments of some of the reflection moments that our staff were able to participate in today. They participated in the White Coats for Black Lives event, and several of our sites had staff join in that endeavor. So, you know, we were very proud to be able to offer that opportunity to our team. And what happened during that moment was that our staff literally kneeled for 8 minutes and 46 seconds in honor of George Floyd. So you can see some of the graphics there from multiple sites at Cherry Health who participated. And this is just a sampling. We had several individuals participate because they understand our movement. And, you know, again, it was just so impressive, and my heart is full with all of the participation had today. So, this really brings us to today's discussion. With tensions mounting across the country and issues of social justice taking center stage, it's important that we have meaningful discussions before we can find a path forward. And then, you know, after we find that path forward, we have to take action to address systemic racism in our community. Now, the disturbing events around the deaths of George Floyd and Breonna Taylor and many others has put these issues on a global stage. And many of us, are unaware of how close this tragedy actually hits. Breonna Taylor, for those of you that are not aware, she was born and raised in Grand Rapids, Michigan. She is a cousin of mine, actually, through marriage. And four of her sisters, as well as her brother, still live in this community today. All of us want to make sure that our participating on this panel today, that the deaths of, Breonna Taylor, George Floyd, Ahmaud Arbery, and so many others are not in vain. And we know that these conversations must happen, even though they're difficult. We've got to start somewhere. And, I'm aware that there have been many conversations just over the last few days tackling this issue of racial disparities, healthcare injustices, systemic racism, and all of these issues that we all know are pervasive. And some of us are just learning now, what that really looks like in our community. But I think these conversations speak to our community's collective desire to do something about it, to make sure that these inequities no longer exist for Black people or people of color. Now, today we're going to be discussing the Black Lives Matter movement, including policing, community activism, diversity and inclusion, as well as leadership. I am honored, very honored, to welcome our panelists. Thank you so much for being here today. First, I'm going to say hello and welcome to Tessa Muir. Tessa is the president of the Junior League of Grand Rapids. Thank you so much for being here, Tessa. I'm also going to welcome Joe Jones, who is the president and CEO of the Urban League. Welcome, Joe. So glad to have you here today. I want to also welcome the president of the Grand Rapids AfricanAmerican Health Institute, Micah. Micah, thank you so much, Micah Foster, for being here. Micah is also a physician's assistant, so he has a unique perspective from both of those worlds. So thank you so much for being here. We also have the Kent County Sheriff, Sheriff Michelle LaJoye-Young. Thank you so much for being here, Michelle. So good to see you. And we also have Graci Harkema. Graci is the president and CEO of Graci LLC, and she is a diversity and inclusion expert right here in our community. So I just want to say welcome to each of you. Thank you so much for being here. And I'm just going to kick the questioning right off. Tell me what the last 90 days have looked like for either you from a personal standpoint or you from a professional standpoint. And we'll start with Tessa.
The last 90 days have just been, I felt this great sense of just a great awakening, really, among my friends and acquaintances and strangers and family members. I have never in my life had meaningful conversations about race outside of a diversity and inclusion formal environment on a board or, at college and in academics. It has just been conversation after conversation after conversation with people at the grocery store, on the sidewalk, my chiropractor, my dental hygienist, like while she was working on my mouth, just conversations about race that would have never come up in my life before. I just feel this incredible energy to learn, to listen, and to act.
Awesome. What about you, Joe?
The last 90 days, I think it's fair to say that for me personally, it's been an emotional roller coaster from a professional standpoint with my role at the Urban League, as well as serving as a city commissioner in Grand Rapids, and as well as a ordained minister. It's just been like nothing I've ever experienced before. I would also go so far as to say the last 18 days have in particular been quite the strain, because it was May 30 when we had the riots that took place in downtown Grand Rapids. And so at that time, my phone and my computer and just any sort of messaging or communication tool that I have has been in full usage. So
Yeah.
it has been it's been quite the experience. In fact, I will go so far as to say that that week after the riots was probably one of the most difficult weeks in my adult life, just in terms of everything that was coming at me, at us as a city, the significant voice that was being heard by the community in terms of their disappointment, their distraught, you name it. It was just a really, really emotional week. And so I'm grateful for days like today, because today is not just, obviously it's Juneteenth, and Juneteenth actually is something I've been celebrating since I grew up in Detroit, so for a long time. But I have declared Fridays as national holidays in my own life. Every Friday is a national holiday. I love Friday. So today is a good day, as Ice Cube would say. So
Right. All right. What about you, Micah?
Yeah, I would echo what Joe said, as it pertains to being an emotional roller coaster. That is exactly how I feel. As a clinician, and even as my role at the African American Health Institute, when the COVID pandemic began, disproportionately impacting Black communities, we were deeply concerned for the health and safety of the community. And we mobilized and began a campaign, and the efforts were all aimed at keeping people safe and healthy. And that concern slowly started to turn towards optimism as we witnessed the community and community organizations come together and intensify discussions around the root causes of these persistent health disparities. And that optimism quickly turned to grief and anger and frustration as we witnessed tragic, unjust killings of so many Black people. But today, as we celebrate the 155th anniversary of Juneteenth, a day of freedom, we're hopeful. We're hopeful because we have a generation of young, strong advocate leaders who are prepared to have these difficult conversations. And we're hopeful because despite the divisions that exist in America, we feel like there's a collective voice, and it's shining a light on institutional racism and the effects that it has in our country. And this is an important step in enacting permanent change. And we've already seen across the country, as a result of peaceful demonstrations and activism, policies changed and procedures and practices changed. And so we're hopeful because we believe this moment can transform into a movement and really propel us forwards towards social justice.
Absolutely. So, Sheriff LaJoye-Young, what has the last 90 days been like for you?
I could second everything everybody has said so far as part of this answer. It has been an incredible roller coaster. There's some public safety issues that law enforcement was intricately involved in as part of the pandemic, and much of the planning for the community and the efforts that we put forward to keep every element of our community safe as possible during the COVID response. Obviously there's a degree of shame that comes when you witness the color of law being used to perpetrate violence on somebody. And that's certainly not the intent of law enforcement. And those of us who've spent many, many, many years in the field doing really good work and leading really great organizations, it's heartbreaking, breathtaking to see that there are people who portray themselves as community servants who act in a way that's disloyal to the community, disloyal to the profession. So, that's been very difficult to watch. It's very difficult from another public safety perspective when we're, the very First Amendment right of demonstrating and using our collective voices to make really real change and to help people understand that we're not all experiencing things in the same way. To see that then be stolen from our community and violence perpetrated on our community in the name of change, which I don't believe is anybody's intent. So as a law enforcement entity, that was really hard to watch, very scary to watch, because the lack of control we had over the safety of the community during those times. So that has been a very difficult time. But I have to say, there have been, there still continue to be many, many moments of where it feels like, you know, at some point we're being held up, the law enforcement entities are being held up as the problem. But there's also been a lot of understanding that, you know, there's a symptom of a problem that can be represented by law enforcement, but yet we're also strong partners in being able to move forward and grow in understanding and help problem solve and see what we can do in the future to make those experiences be different. So many of our staff share, like Tessa talked about, we're having very real conversations around race and law enforcement, and really getting some emotions out as part of those conversations internally and now externally. And I see all that as being really, really positive and growth experiences for our agencies. So I'm hopeful about where this goes. Just like the name of this panel discussion, taking these moments and make them into movements and making it be that everybody in our community feels like our law enforcement is from our community and for our community and doing good things within our community. So I'm hopeful, I'm positive that that's where we're headed, and I'm loving the fact that I'm right here right now and able to help in any way possible.
Awesome. Thank you so much for being here. What about you, Graci, in your work, you know, as a diversity and inclusion expert? What has the last 90 days looked like for you?
It certainly has been very challenging. So at the beginning of this 90 days, when as a diversity and inclusion consultant whose business was primarily focused on speaking in front of crowds and doing training, I in the time of COVID-19, when that broke out, it was a decision where I had to ensure that I was staying relevant, but also I had to pivot my business with everything canceling. So I pivoted my business to write a book. So I'm writing a memoir currently. And ironically, my memoir is on experiences that I've had as a Black person, as a female, as an immigrant from Africa, as an interracial adoptee, and also as a queer woman in the LGBTQ identity, and the various challenges and adversities that I've navigated through personal life and also as a reflection in corporate life. And the premise of the book is to be a learning opportunity for folks to be able to see different perspectives and to learn to be more equitable and inclusive. Then we all witnessed the tragic murder of George Floyd. And then I had to shift my business again to suddenly I was getting calls from organizations left and right who suddenly realized that racism exists. And so that was a hard pill to swallow, to want to be supportive and want to continue the work that I've been doing, but also struggling with the idea that finally folks have been awakened to what Black and brown people have been living for our whole lives and for generations before us. So it brought on a lot of heartbreak, it brought on anger, it brought on sadness. And it was also very wearisome to be able to take on all of that from external sources when I was still dealing with my own internal healing and trauma with watching what happened to George Floyd and seeing how people reacted to it, specifically in wanting to disregard racism and wanting to disregard the journeys that we've lived. Mm-hmm. And so I've had to harness that hurt and that anger and that sadness and mold it and create it into positivity and create it into strength, because now is the time. Now is the time that we need to rise up. Now is the time to create change that is going to be lasting, not just for a social media post, not just for a protest, but to create change for lifetimes to come. And so at this day and age, through the journey of the last 90 days, I am empowered and inspired and excited to be a part of helping people come to this place where they are ready to create change and helping them along the journey of doing the work.
That's awesome, Graci. So I just want to kind of piggyback on that point. So, you know, many people in our community have not had these conversations yet. They haven't participated in dialogue like this before. And this is hard work. I mean, these are really tough conversations. They're very sensitive. And sometimes people don't even know how to get started. Like, you know, what is the first step to having these conversations? So, you know, I'm just asking as a diversity and inclusion expert, what advice would you give to people who really aren't sure how to begin the conversation and how to start the dialogue around social injustices? What would you say to companies? And I'm sure you've actually had this conversation based upon what you're saying, that people have been reaching out to you because they want to take that next step. They're just not sure what that next step truly is.
Certainly. So from an individual humanistic level and also from an organizational business level, it's important that that first step is taking a look in the mirror and doing some deep reflection. If we have been in a place where we've never had to have tough conversations, or we've never had to talk about racial justice or racial inequities, let's learn why and check our own biases. Are we coming from a place of privilege where we never had to have those conversations because we never had to think about it? Or are we more so not having those conversations because they are too hard, or we're too afraid to, or we don't know what to say, or we don't want to say the wrong thing? So if those are the cases, then we need to ensure that we're checking into our resources. We're reading, we're staying up to date. There are plenty of incredible books, just to name a few, Supremacy and Me, White Fragility. So you want to talk about race. It's important to do our homework. If we don't understand the racial journeys of other people's lives who look different from us, we need to learn about what those journeys are first, and learn about systemic racism and how it's rooted and how this is manifested. And that means that we've either been, if we haven't spoken about it, that means we've either been an enabler for racism, or we have been combating racism. If we've been an enabler, meaning if we've been silent, now is the time to lean in to our diversity and inclusion experts, to lean in to folks that are providing a safe space where you can learn more. That does not mean call your one Black friend and pick their brain about all of the experiences they've had about being Black, because that isn't fair for one person to speak on behalf of the entire race. But it means let's take a step outside of ourselves and be open and empathetic. Let's check our biases and then learn to break down those barriers. And if you are in an organization, if you are a leader in that organization, let's look at the organization. Who is sitting at the table? If everyone sitting at the table who are making decisions looks like the person sitting next to them, then we have a problem. And we need to ensure that we are being intentional in diversifying our networks, and also ensuring that we are building bridges with underrepresented and marginalized communities, and that we are establishing policies and practices in place that say that we do not stand up for racism, that say we will not condone discrimination, that say that we will not allow one employee to inhibit another employee to be able to come to work as their true self. And when we establish those policies and practices, we need to ensure that we are holding ourselves as leaders accountable, and that employees are also holding ourselves and each other accountable to ensure that there's disciplinary action that occurs if those policies and practices are broken, so that we are providing a safe and inclusive environment for our employees to come to work. We are providing a safe and inclusive environment for us to have these tough conversations without the fear of retaliation, without the fear of being tokenized, without the fear of it incriminating our work or how we are valued as a person.
Wow. Very, very good. Thank you so much for that, Gracie. You know, as the panel replies suggest, you know, these issues of healthcare, you know, employment, education, all of these things that we've talked about, they're intersectional. So, Joe, I'm going to pivot to you next and talk about how the social determinants of health contribute to the inequities that we're currently seeing and that have been around for some time, quite frankly.
Yeah, I think now more than ever, the microscope is really focusing on the social determinants of health, and people are beginning to understand, as Gracie has mentioned, the root cause to a lot of you know the issues that we're dealing with on today. It's really easy to just kind of point fingers and assume, or just kind of say it's this person's fault or it's this group's fault. But the real work is when you take the opportunity to dig and understand the root cause. And so the social determinants of health, these are these inequities, they arise from inequalities with and between societies, I think is a good way to put it. Social and economic conditions and their effects on people's lives determine their risk of illness and the actions taken to prevent them becoming ill or treat illness when it occurs. And so I think when it comes to health, I want to look at, if I can, two things in particular when it comes to social determinants of health. One is economics. And so when it comes to health, there are many factors that influence how long and how well people will live, from the quality of their education to the cleanliness of their environment. But of all of the social determinants of health, research shows there is one that is perhaps the most influential, and that's income. And again, at the Urban League, we focus quite a bit on income. We focus quite a bit on everything that we do. Really is focused around the social determinants of health and how can we help people to live a more abundant life and help to improve their life chances. You can do that through quality housing. You can do that through income or opportunities to generate wealth and have prosperity. Research shows that at all levels of income, our health is affected by economic conditions. So I think people don't realize that even middle class and upper middle class people are in worse health than richer people. And until we begin to recognize that we're all in this together, it's not a problem just restricted to the very poor. And I think people are quick to assume that social determinants of health are all about poor people, when in fact, it's about all of us. And with regards to housing, which is, again, something that we have leaned into at the Urban League now for over 75 years, housing as a physical structure, it really serves as a source of stability or stress and part of a neighborhood and a community. It affects residents' health. Health and housing partnerships are rooted in evidence that improvements in housing can support physical, mental, and behavioral health. And so again, people tend to, when you've lived a life in which you've not had a whole lot of difficult times, you obviously take it for granted. But we're living in a time right now where housing is, it's almost becoming a privilege. When in fact it really is a right, affordable housing or just quality housing. And so we are, again, more than anything right now in our country, in our community, I think it's a good thing that we're leaning in and paying more attention to the very root causes that have us where we are on today.
Awesome. So, Joe, you touched on the social determinants of health. I think it's perfect to pivot to Micah about healthcare disparities. And, in your work as the executive director of the Grand Rapids AfricanAmerican Health Institute, also with the fact that you are a Black man, and with the fact that you are a physician's assistant, just talk a little bit about healthcare disparities and how you've been impacted by this time as well.
Yeah, I think that's a very important topic, and I really couldn't agree with Joe more. I think he hit it right on the head there. Healthcare disparities exist across nearly every marker that we look at, from diabetes, to cardiovascular disease and stroke and some forms of cancer, and so it really shouldn't be a surprise then when we look at the coronavirus pandemic and how it's disproportionately affected Black and brown communities. And healthcare and access to healthcare is one of the social determinants of health. But when you consider all the factors that actually go into making you healthy or me healthy, the healthcare system is just one small piece of the greater pie. And so you have to consider food deserts, housing, food insecurity, living in a densely populated area with poor air quality, and how all those other factors contribute to your health and increase risk of adverse healthcare diseases significantly. And when we look at the social determinants of health more closely, and when we look at housing, like Joe mentioned, well, what contributes to the current housing crisis we have in this country? And it's clearly related to our history of residential segregation, income inequality, redlining, unequal access, and quality of care. So all of these things contribute to our health outcomes. And I would say that the social determinants of health, to go one layer deeper, are in fact a result of systemic disparities and born from policies and practices that are rooted in racism and in our country's history. And these effects are felt in every generation. When we think about our mental and physical health and our life expectancy, Black people deal with trauma from racism, micro, macro aggressions daily. And over time, these insults all take their toll on our physical and mental bodies, and it causes significant stress over the lifetime. This elevated cortisol level damages the body over time, and chronic stress weakens the immune system, your ability to respond to a coronavirus, your ability to withstand those extra social the stressors and strains, and cause mental health problems like depression and anxiety. And physically elevated cortisol can lead to heart disease and high blood pressure and heart rhythms and stroke. So we can see then that the consequences of the environment we're living in are not, like Joe said, they're not individual choices. You didn't choose to get diabetes. It's the sum total of all those social determinants that play into your health.
Awesome. Yeah. No, I totally agree. As you discussed, Micah, there are still some policies and practices that exist today which disadvantage Black people and communities of color. So Tessa, I wanted to pivot to you and just talk about, how we support the development of future leaders in our community while making opportunities available for everyone, including people of color. And I also want you, if you're willing to just touch on, there's been a lot of back and forth about whether or not these racial injustices, whether this is a political issue. And I know you and I have had some conversations about that. And I've really never thought of it as a political issue, but I'd like you to kind of share your thoughts as well.
Sure. Thanks, Tasha. Yeah, I mean, I think in terms of training people as leaders to take a leadership role in this, the very first step is self-education. So if anybody is in any sort of position to lead any sort of group, even a listserv of email friends, I think it's really important to put out specific resources for self-education. So, hey, here's a great documentary I watched. Here's a list of podcasts that I'm listening to. Here's a really important book that I just listened to. I have a whole list in my Audible library right now of the books that Graci was talking about, and Stamped and White Fragility, and all the books on anti-racism. They're all in my queue, and I'm going to be doing it all year long and into the future, and I'm telling everybody that I know about them. For me, leading these sorts of discussions with people that I know, Tasha, it's been really helpful for me to lead with saying, this is not a political issue. This is not a partisan issue. I'm the president of the Junior League of Grand Rapids, which is a nonpartisan, all-women volunteer leadership organization. And we put out a very strong statement about our position on anti-racism and diversity and inclusion training, and our support for Black Lives Matter and our Black members, and our desire to have more diversity. And I've made in all of those statements very clear that this is not a political issue. This is not a partisan issue, which of course it's not. It sounds ridiculous to have to say that in a panel of highly educated, highly aware people. But sadly, it's true that some people get defensive about, I mean, somehow COVID became a political issue. So anything can become a political issue. But this is about equal justice for all people who live in America, equal justice for all citizens of this country, equal justice for all human beings. There's nothing political about that. So I found that is a really easy way to like lead in and to make these statements on behalf of an organization and even among friends. I think another thing that's been helpful and something that I'm working on is sort of moving into a new era of see something, say something, which we heard after 9/11. You know, you see a backpack in the subway, you see something, you say something. I'm just taking that as my new mantra. If I see something or hear something that is a microaggression, a macroaggression, something that's blatantly racist, insinuating racism, I'm going to say something. People obviously need to be called out on that and have slid for way too long. I don't know if they're doing it deliberately or unconsciously, but I'm hoping that we can all step into the leadership role of correcting those sorts of behaviors and thought patterns and opening up a discussion about race with people who might not have been comfortable in the past or aware in the past of racial issues. And then in terms of training the next generation of leaders and turning this moment into movement, I think that it's really important for people, especially young people, to get into positions of leadership. Systems don't change from the outside. So get into positions of leadership, join boards, put those boards on your resume, get onto more boards, put those boards on your resume, network, go to events, rub elbows with people in the system so that it can be changed from inside. I was thinking a lot about the women's suffrage movement and how women picketed and brought the issue to light for a very, very long time. But it took the men sitting in power in the legislature to change it because they were the people in power at that time. So anybody who's in a position of power in any sort of system, whether it's a college, government, law enforcement, a nonprofit, hospitals, any sort of system, the people on the inside need to be the ones who are educated, who are speaking out, and who are making change from the inside.
Now, Joe, you spoke a little bit earlier about economic security and stability, and just kind of to piggyback off of that, there has been such a outcry about Black Lives Matter versus All Lives Matter. And, people see this as an either or proposition when it really isn't an either or proposition. Can you kind of share more about that so that people gain a deeper understanding of why the Black Lives Matter movement is diluted when All Lives Matter becomes the focus?
Yeah, I get this. Actually, I get this question quite a bit. It's a worthwhile debate, and it's usually a rather short debate. Not because I'm super smart, but because I think it's fair to say that the aspiration, the universal aspiration, is a society where all lives matter. I think we can all agree with that. But if we just focus on or proclaim that, if that's all we focus on and that's all we proclaim, and we stop there, we're really ignoring the reality in America. And I think that is obviously the differentiator. And so here's the fact: all lives do not matter in America. Okay, and some of this difference is how whites and blacks are differently situated, not only in our geographic and our psychic structures, but also in relationship to police and other institutions. I will say without any hesitation that Black lives have been constrained and they've been cut short. And so when one replaces Black Lives Matter with All Lives Matter, one may be slipping into a false assumption that we are all similarly situated. We are not. And that's quite often a very difficult pill to swallow. Some have even cautioned that by saying that Black Lives Matter, we are evidencing concern for Blacks and no one else. This is apparently seen as being targeted without also stating the universal. Again, there's always this desire to say, hey, what about us, right? As a whole. There might be times when we choose to be universal without targeting, or targeting without being universal. So again, back to the question at hand. We might respond, all lives should matter. However, there are many expressions in our society that make it clear that Black lives do not matter as much as white lives. It becomes especially problematic when people are aggressively killed solely because of their Blackness. And again, these are things that we have to begin to look at and talk about, as uncomfortable as they may be. And simply because we're seeing it occur, right? It's like there's no other explanation but that. What else could it be? And so, you know, to some degree, it is a mistake to suggest that only Black lives matter. And these questions may also lead us to ask, what about Latinos or Native Americans, the disabled community, right? LGBTQIA community, and many other groups who are treated as other in our society. And those are legitimate questions, and it's an approach from the lens, I would say, of targeted universalism. That would help significantly. But I will leave that for another gathering. For now, I will just say that you know, all lives should matter, but in this America, from Ferguson to Charleston to Minneapolis to Atlanta to Georgia to we are constantly reminded that Black lives have not mattered as much as white lives have. And by proclaiming our target of fully embracing that Black lives matter, we come closer to our aspiration of a society where all lives matter. So I apologize for being too lengthy, but it's you know, there's a lot there. There's a lot there.
No, I agree. I mean, I think sometimes people take the societal all lives matter as more of a personal charge. And for you as an individual, all lives might matter. But as a society, you know, it has been shown that all lives don't matter. And until we're to a place where Black lives matter, Brown lives matter, LGBTQIA plus lives matter, only then will we get to the point where all lives truly do matter. So Sheriff LaJoye-Young, Joe brings up, you know, a question about policing, and, you know, policing is on center stage right now. I just am interested in your thoughts on, you know, how from a policing standpoint is the sheriff and your department dealing with these issues, and where do you see kind of policing going into the future?
Those are some great questions, and this is something that, you know, it's a great big conversation that has happened over several years, if I'm being 100% frank about it. I think I visited Joe, was it probably a decade ago now, as I started to take on leadership roles at the sheriff's office, to really have some serious conversations about why we're having difficulty diversifying police departments and why we're having difficulties diversifying our leadership within police departments. Because, you know, I truly believe, I think we all understand that, as Tessa said, if you're not sitting at the table when decisions are made, there are perspectives that are left out of those decisions. It's just inherent. And so, you know, that's part of the bigger conversation that we're having. So we can put a circle around police brutality, and I think everybody in every decent circle in the world understands that police brutality is wrong. But to really understand how we're getting to the point where police brutality is happening, it really has to be teased out into a whole bunch of smaller conversations. Some of them we've already started here at this table, but some of them are a little broader even than that, having to do with what is against the law. in what circumstances are people coming in contact with law enforcement, and how are those issues really playing into that relationship between communities and law enforcement, and the types and the amount of contacts that they're having. And then in that regard, how does brutality happen when those contacts are more and more common? So all of those things are part of the conversations we're having. We're trying to understand how to move forward effectively, and being sensitive to what our community really needs us to do, and those parts of society that we can be a help in, and then try to advocate for change in those areas that we find ourselves in that we don't need to be a part of. And I'll use mental health. Micah brought it up as part of his conversation. Mental health is a big deal in almost every community in the United States, and there's a gap in services for mental health. Often that finds a contact with law enforcement for somebody who truly just needs mental health services. And because those are inherently, I'll say volatile, and I don't mean that in the violent way, but it could go in a host of different ways depending on how that person interacts with the person who needs mental health care. And, police have a set of training, a set of service aptitudes that they come to the table with. And so when you are trained with a hammer, you're going to look for a nail. And that's the way things are going to be no matter what field you're in. You look to use the tools you've been handed. So, it really gets to a point of us figuring out where the police have been used in places the police shouldn't be used. Let's try to segment those issues out. Domestic violence might be another example that I've heard. The law is very specific how law enforcement is to work within a domestic violence circumstance. But many, many, many times intervention prior to police contact would have resolved the issue and gotten help for people who needed help. And so trying to segment out when we're using police that we don't need to use police, and try to figure out how that can improve our relationship in our community, and then help the police understand some of the trauma that has been experienced related to racism, help the police understand how that does impact what they see when you come to the scene and say, "Yes, sir, you called for service. How can I help you?" And how that person's looking at you when you roll up on that scene initially. And so that you can be informed by how perhaps you need to listen differently or watch differently for what's going on than what you might in your history. I think all those things have to be really taken into account as we're looking at police work. I think it's a challenge because, again, diversity is so difficult to foster within a law enforcement agency. And I have to be frank, it's not getting easier. It's probably getting harder as we speak right now. And so our community of color really has to join us, if you will, in saying to young people, a career in public service is honorable. A career in public service is something that we need you to aspire to, because we need you to help be a law enforcement or whatever your particular skill set is. We need you to do that from your perspective so that you can service your community in a way that is right for your community. And so I know I'm saying a lot of words all at once, but I think these issues are so interrelated, and we really have to have some honest conversation. And again, until we get a fully diversified force, law enforcement force, I don't think anybody's really going to be happy with the outcomes, because you can only put so much oversight in place from a practical standpoint. Change has to happen from within. So we're going to have to be really collaborative on how we insert some other voices into that policy making process while we're waiting for leadership to really step forward in a diverse way, because it's not something somebody's ready for. Just practically speaking, they're not ready to take on a leadership department at the sheriff's office 2 years after they get hired. It won't work effectively. And you have to build up into the field. So I think we do need to work together. But if we work together, I think we have possibilities of some really tremendously powerful outcomes where everybody feels like they're serviced by their government. And then one last thing, the sheriff's an elected office, mayors are elected of office, they hire police chiefs. I mean, I think these are conversations that need to be had at the kitchen table, at your community tables, in your neighborhoods, and then at the polls. You need to vote for people who are talking about doing things to make policy decisions different in the years to come.
No, I couldn't agree more. I think that there also has to be a pathway for young people to be exposed to policing, for young people to even trust the police in our community, whether it's, the sheriff or because part of the issue is, you've got youth right now that cannot unsee the situation that happened with George Floyd. I mean, having to explain that situation to my children has been very difficult. In fact, when we took a knee earlier today as an organization, I mean, I cried because, 8 minutes plus is a very long time to be on your knee in general. So to think about someone's knee being on somebody's neck for that long, it is a long time. So, I'm thinking about how do we rebuild that trust? And I can speak to my interaction with the sheriff's department. You guys have been great. We've had situations in my own family personally where you guys have just the sheriff, the deputy sheriffs have been amazing. I'll just say that. And they've been amazing in situations where they could have used probably a little bit more force with a particular situation with my son. But I appreciate what you guys have done, but how do we create those opportunities for students, for young people to become excited about the field and not feel like there's a target on their back? And then we say to them, we want you to become a police officer when there's a target on your back. So how do we get beyond that? So I'm interested in your comments to that, Michelle, but also maybe Graci and Joe. Graci, from a cultural competency standpoint. So the sheriff was talking about how do we train train the police officers to react maybe differently than they do today, just based upon, like you said, Sheriff, the trauma that people experience. So when you roll up on the scene, maybe what you see looks different in another, in one community than another community. Maybe it looks different in one culture versus another culture. Maybe one culture, it is disrespectful to look someone in the eye. So they're going to look away. So whereas somebody thinks that is, an issue, maybe that's just their cultural norm. So how do we create those pathways, Michelle, for kids to begin to trust again? It's not that trust is broken in all areas of policing, because obviously you guys do, an amazing job keeping us safe. But how do you break those walls down?
Right. And I think this is a growing solution, right? One that needs to be fed as we're kind of moving forward on this movement part of it. I do think having opportunities of longer term learning need to be an important element of what we do as we build forward. And I'll give you a couple examples. There's, a promise zone in Grand Rapids. So young people coming out of high school go directly to GRCC, and they have an opportunity to get a good education and prepare to move on to their adult life. It's usually an associate's degree. If I take an 18-year-old young man and put him in a 2-year program to be a police officer, now he's a 20-year-old young man. And one of the things that I think is the most powerful thing to prepare somebody to be a police officer is preparing somebody to be a human being. And sometimes young people don't have the emotional intelligence to be a police officer until they get later into their 20s, and sometimes not even then. So having this developmental path that isn't, a checkbox, isn't, I'm going to send you to the academy and then I'm going to put you and try to pretend that you're prepared now to deal with what life will throw at you as a young police officer, because it can be overwhelming. Tremendous amount of trauma comes at people as a police officer, different in some ways than what comes at community members, because you're looking at it from a perspective of you're supposed to fix it and you can't. And so there's a reality of timing that comes with taking young people, but a lot of contact over a long period of time, I think, does help. We have a pretty robust school resource officer program where we have police officers in most of the high schools in the county that are in our patrol area. And we have seen many, many, many young people who have developed long-term, positive, strong relationships with the officers that are in their schools. And they help understand that that officer is a person, and that officer understands these are all individuals with individual hearts, minds, souls, hopes, dreams. And you look at them differently than the young person with a hoodie on, or the young person driving a car that probably has about 4 violations on it as they're rolling up into the high school parking lot. You're looking at them as a young person who's trying to get to the next point of their life. So I think all of that really helps, but I think also the conversations at home have to take place. Families have to encourage their young people to go into public service and to see it as a noble career. So how we can educate families about careers in public service, that would be another really important part of this. Moms and dads, don't let their young Black or brown people go into police work easily. They are scared for them, and they are afraid that they're going to be mistreated. And, and obviously we've seen that can happen. I can tell you in most places I know of, it doesn't happen, but it can. And I understand that. So
Graci, cultural competency training.
Yeah, definitely. So, Sheriff, I certainly appreciated the points about talking to our children and talking to our family about going into public service roles. But what's imperative before we can even have those conversations, before we can even have trust, there needs to be accountability within those police departments. And those are immediate actionable steps that can occur today that aren't necessarily, we don't necessarily have to wait years to see the change, where we need to have accountability in ensuring that there is severe disciplinary action when we are wrongfully profiling, or when we are wrongfully overly using force against Black and brown faces simply because of the color of our skin. We cannot trust until that accountability and those policies and practice are being executed and being followed upon. And until that happens, then we can start to have conversations about career pathing and what's going to be best for a long-term solution. But we're not in a place currently to talk, and this is, I'm talking about over the board. I'm not just talking about Kent County or Grand Rapids. This is across the board. Statistically, we have seen too many times. And now the world has finally seen what we have been living our whole life. And that accountability within the police department opens up the opportunity then to continually build bridges within the Black and brown communities. But those bridges can't be built until the police department within itself understands how important and how imperative it is that we no longer let this crucial behavior and this racist behavior continue.
Go ahead, Michelle.
Yeah, and I just want to second that. There absolutely needs to be accountability. I support all the legislation that has been proposed in terms of some really basic, fundamental things. I want to say that I know there's a thing circulated right now, 8 can't wait. there's some really crucial initiatives that people are advocating that law enforcement take throughout the country. We reviewed our policies, and frankly, my last use of force policy was dated 2011, and every single one of those elements were addressed in our policy and has been enforced. But you're right, everybody has to trust that that basic level is there. And I would advocate even further than that. There has to be a civility, a respect, a human beingness to the way people are being treated when they're met with police services. And if you make the ask so tight to those basic things, we kind of leave out the fact that you should feel like calling the sheriff if you were treated rudely. You should feel like calling the sheriff if somebody didn't listen and resolve your bigger picture issue, that they were too pinpointed in their perspective. You should feel as part of the community that you can ask for a lot more than not to be injured or not to be profiled. And I really need this conversation to move even broader than 8 can't wait in Kent County, because that bar is not high for Kent County. That bar is not high for Grand Rapids or Walker or Wyoming or Kentwood or the community. That bar's in place. We have removed officers for being persistently rude. I have personally terminated officers for being persistently rude, and will continue to do so. So I just advocate, as we're talking through this, yes, that's a basic, but we need to ask for more.
Joe, did you have any thoughts on that?
I would say that one of the, in my opinion, one of the impediments that exist right now is in terms of real consideration for young people of color considering law enforcement, has a lot to do with the disconnect that they feel to the average officer who, I guess, primarily in our city, does not look like them. Mm-hmm. Again, treats them, does not treat them all the time with dignity and respect. And I'm not foolish enough to believe that our young people aren't always showing the police the respect they feel as if they deserve either. So you have that as a pretty significant barrier. And I think ultimately, I do believe that that presence matters. And I think that when we can have a society or community that on a regular gives our young people an opportunity to see success that looks like them in all facets of leadership, then we'll be progressing to a better place where we can perhaps then have young people consider law enforcement. But until that time, I mean, again, as the saying goes, it's really hard to be what you cannot see. Mm-hmm. And I think that's front and center with regards to law enforcement right now within the Black community in Grand Rapids. And I think that in my opinion, I don't think the department has, and again, speaking from Grand Rapids, they have not done enough, because again, it really takes a concerted effort to begin to see these young people as human and as well as having value. And I think that there's been too much of a devaluing in our community as it pertains to, in particular, the African-American community and law enforcement.
All right. So great discussion. I appreciate all of your comments and all of your thoughts. I mean, it definitely, being a public servant is a noble role in our communities. And we've got to figure out how to help our communities to restore some of the trust that we talked about, so that they can begin to police our communities, so that our children can say, hey, this is my community police officer that lives in my neighborhood, that knows my parents. So that they are on a first name basis, which I think can cause substantive change throughout our community. But I wanted to give an opportunity, as we kind of wrap up, for everyone on the panel to just kind of provide some closing thoughts around actionable steps that we might take to move forward as a community? Because, I mean, we've talked about some of what we can do from a policing standpoint and some of the things that the sheriff is actually working on and has been working on for some time. But what, from those of you that are on the panel, I'll just kind of start with Micah and then maybe go to Tessa, and then we'll come back to Graci and Michelle and Joe. So Micah?
Thanks. Yeah, I would just echo what Graci said earlier, and I think even Tessa also said the same thing, which was any sort of change on a systems level starts with change on a personal level. Systems are made up of or at least governed, I would say, by policies, right, and procedures and laws, but systems are made up by people. So this represents, this moment in time represents a critical moment in this country and an opportunity for each of us as individuals to learn. And in so doing can lead to our nation healing. And so I would just echo exactly what they said. Take some time to reflect on your learnings from today, no matter what your race or ethnicity or culture is. Take some time to understand your own implicit bias. We all have them. We're all born with them. We're all ingrained through socialization. And so take a moment to reflect on how you view the world and the people around you. We live in an information and knowledge-based society. You can Google a number of different tools that will help you learn about your own implicit bias. When we think about racism, racism, it thrives on fear, and it comes from fear, and fear comes from the unknown. We inherently fear what we do not know. And so when you begin to educate yourselves, you really equip yourselves with the tools to change the world.
Awesome. Tessa?
I think in terms of action steps, honestly, is for white people to talk to other white people about racism. I mean, this racism is being perpetuated by white people, and white people are the least likely to talk about it. They're the least likely to be educated about it. They're the most afraid to step on these landmines, so they just don't say anything. So I think for people to reach out to their white friends and say, I'm just so heartbroken over what happened with George Floyd. How are you processing all of this? Conversations like that just need to happen more, where people can be vulnerable and talk about race in a way that they haven't been challenged to before. If we're going to shift the burden of change from Black people and people of color bringing up the issue, which clearly has been done for hundreds of years, now to white people to make systemic change, to tear down systemic racism, we're going to have to push the conversation into those laps and challenge our white friends to talk about race in whatever small of an audience they need to feel comfortable, and go from there.
What about you, Graci?
So after all of this, after we're no longer hearing about George Floyd in the news, when we're no longer hearing about Breonna Taylor, when we're no longer hearing about Ahmaud Arbery, when we're no longer seeing the protests happening, or it's not being talked about as much, don't forget this. Keep doing the work. We don't have to see it on the news to know that this is important work. We should know it here and hear that this is important work. And we need to learn how to have empathy and how to have grace with one another, especially from those who walk different journeys than ours. And be a safe person where you can ask questions and people can ask questions of you, where we can learn and grow about one another and understand and learn how to truly be an ally. Because sadly, there's going to be another situation. There's going to be another George Floyd with someone else's name. And when that happens again, we need to be prepared and ready to continuously keep fighting this fight, but ready to be open and have these tough, uncomfortable situations and not wait until the next headline to have those conversations.
All right. So I think Joe, and then Michelle, I'm going to give you the last word. Sheriff LaJoye-Young. I'm on a first name basis, but Sheriff LaJoye-Young, I want to give you your respect that you deserve.
you want me to go now? Or
Let's have Joe go, and then give you the last word.
I want to first say thank you, Tasha. I want to give you and Cherry Health a mad shout out for putting this together. I greatly appreciate you and your leadership and the fact that you do it with such ease. And so thank you for what you do. I would simply leave three things that I heard from a very dear friend of mine who has a pretty much an all-white congregation in town, a rather large congregation, and he provided this advice for his membership, and it started with the number one thing is look back. We need to, as a country, continue a commitment to look back, which means that we need to understand how we got here, and you can only do that if you become a student of history, of all of the history, not just some of the history, all of the history. So we need to look back. Second thing we need to do is we need to lean in. Instead of running away from the very difficult conversations, the discomfort, the things that, again, we don't want to talk about, we instead need to lean in and better understand why things are the way they are. And thirdly, we need to love well. If it's one thing that we all have the capacity to do, we have the capacity to love. And so why not, to the best of our ability, love well? So that would be my three things.
Awesome. Yep. All right, Sheriff LaJoye-Young.
I sat in on that sermon and it was incredibly powerful. I just want to end with thank you for having me here. Thank you for inviting me to be part of this conversation. And, my advice to officers, and we are talking a lot, and as you can imagine, it's been a difficult time for officers as well. But what I am advising people is take this opportunity to listen, and listen with the intent to really hear the pain, hear the history, hear the issues around the fringe of police brutality, not just police brutality, but the lack of having officer in your community that you know by name or that you have a relationship with and you can call and have them support you. We have to really hear those things. And then we really have to take a very deep look at all the factors that have led to that within our policies, and stop being defensive. Because I have a lot of people who see themselves as really good human beings who set out every day to help people. And that truly is in their heart, that they want to help people. But you have a way of doing things that is based on your history, based on what you want to believe is true and what you have been told is true. And sometimes we have to break down how we're trying to help. We have to go back and start again and come up with different ways. So in police work, we are doing that. I am encouraging people to continue to do that. And again, I don't want to say keep us honest, but keep us engaged as this conversation about, this specific moment in time starts to die down. Keep us engaged in the positive pursuit of really dissecting this issue and how it relates to police work. And again, I'd advocate there are a number of things in the criminal law realm that really has to be evaluated, or we're not going to see real systemic change. What is criminal, what isn't criminal, what the consequences are for criminal behaviors. Something as simple as do you get a ticket when you're trespassing, or do you get brought to jail? Sets up a whole chain of circumstances that have major impacts. And these are community conversations that your elected officials have a lot to do with. So let's not forget that part of the conversation too. And God bless everybody. And I truly appreciate being part of this community.
Yeah, I love what you said, Sheriff LaJoye-Young, about listening with the intent to really hear. Tessa and I are commiserating over the fact that could be a series, listening with the intent to really hear. Because I think that, some voices have been silenced. And if we're going to make sure that everyone knows that they are safe in our community, that they are cared for, and to Joe's point, they are loved. I think we're going to have to make sure that those voices are amplified. And the only way you're going to amplify them is for them to really feel like they're being heard. So I just want to thank you all for being a part of our panel today. Thank you for the work that you're doing in your respective organizations to address these issues and to move the community forward with greater equity, with greater awareness about some of the systemic injustices that have been occurring over many years. And thank you again for just being here today. I hope that those that are listening, that you feel inspired to take the next step. You know, listening to this podcast, to this Facebook Live is a really good first step. Martin Luther King actually said, take the first step in faith. You don't have to see the entire staircase, just take the first step. So in my opinion, this is a first step, but now the next step, which is an action step, is up to you. So what are you going to do in your sphere of influence, in your community? What are you going to do to make sure that these equities are no longer an issue for, you know, our upcoming generation? You know, I think about my children and eventually my grandchildren. I want this world to be a better place for them. So what are you going to do personally to make sure that this world is a better place for our loved ones? So again, I just want to say thank you for being here. This is part one of the conversation because, again, you can't solve this issue in one discussion, but you can actually start generative conversations around what needs to be done to move forward. So again, I thank you all for being here, and Godspeed.